Hi there, my name is Matthew McGregor, and today I'm going to talk about a diagnosis of the protagonist in Fight Club. So the narrator in Fight Club is an overwhelmed or overworked insomniac who lives a pretty monotonous life, working for an automobile company. The narrator is addicted. Sorry, he's not an addict. He's addicted to going to group therapy sessions for problems that he doesn't have. And I think it provides him some solace to the fact that he doesn't have to deal with these problems. And then the environment of Fight Club kind of takes place in an unnamed city, very overwhelming, and also in a corporate environment in which, he doesn't really seem like he does any work that is beneficial for society as a whole, which I think is what he's looking for. And then the film utilizes dark coloration and the overwhelming feeling of isolation to highlight the protagonist's turn to Tyler Durden, which is his other personality, as we'll find out. So dissociative personality disorder dissociative identity disorder, as it's also called, is a person who has two or more personalities, and this can result in lapses in memory while each personality has control over the body. And this is usually caused by severe trauma, such as sexual or domestic abuse. Pretty much during a young age is when it starts popping up. And the protagonist, he works a dead-end job that he hates, and he believes himself to be an insomniac because he always feels so tired. While the movie never explicitly mentions his childhood, it could possibly, be inferred that the narrator was not raised in a very satisfying home life. And it's also as if it's almost like he creates Tyler Durden in order to correct feelings of anger he harbors for a world in which he feels so impoverished, both physically and mentally. So evidence of DID or what would you see as DID? So according to the DSM-5, one of the most common signs of a person who suffers from DID is lapses in memory and an inability to remember where or how you arrived at certain places. So in the beginning of the movie, you can see this when the narrator is randomly waking up on planes and in different cities without knowing how he ever got there. This is an example in lapse in memory due to a different personality taking control. And then towards the end of the movie, when all is unveiled and the narrator figures out that he really is Tyler Durden, the movie cuts to flashbacks of him fighting himself in abandoned parking lots. He's just fighting himself, not Tyler Durden, who he thinks he was fighting, and images of him talking to himself and impersonating Tyler Durden, because that's who he is. He is Tyler Durden. And then one of the most memorable scenes is when the narrator calls his girlfriend Marla, and she tells him that sometimes he is so shallow and self-righteous, while other times she sees a sensitive side in him. This is a clear example of the effect that multiple personalities can have on other people and how they view certain people who have DID. So treatment, the best treatment would be psychotherapy, so that the patient can talk this out with a professional. This would allow them to have some relief and maybe have some normal functioning in life. They can also take medication to help with DID symptoms. One hindrance that could pop up with dissociative personality disorder is that a doctor might be hesitant to believe a patient or prescribe medication because the patient, excuse me, is male, and society has kind of this norm where they look down on men who cry that they have problems, and so that could be a reason. And then, so the broader perspective, film versus psychological disorders. Fight Club, it seems to offer an accurate portrayal of dissociative identity disorder because of the symptoms of the unknown protagonist, what he suffers from. But these symptoms are greatly exaggerated, and the film uses the wrong kind of situation for how the disorder arises and develops in the protagonist. Because of this, despite the great movie that Fight Club is, it is an inaccurate portrayal of dissociative identity disorder. Thank you so much and have a great day.